Hey guys, so today I'm going to be talking about mental health insurance coverage and why I think it is so important in today's society. So I'm going to start off by reading you guys the definition of mental health. So the World Health Organization defines mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his own community. So, mental health has a very long definition because it encompasses a lot of different things, and it is very important to keep ourselves healthy when it comes to mental health because it can really affect all aspects of your life. So, mental health insurance is basically insurance coverage that pays for a portion of the insured person's mental health expenses either directly or through reimbursement. So, it basically works the same way as regular health insurance. And actually, as of 2014, most individual and small group health insurance plans, including plans sold on the marketplace, are required to cover mental health insurance and substance abuse disorder services. Medicaid alternative benefit plans also must cover mental health and substance abuse disorder services. So, a lot of these health insurance plans are actually now covering mental health visits, which I think is awesome because it is so important. And the Mental Health Parity and Addiction Act states that mental health coverage cannot be any more restrictive than any medical or surgical coverage. So there's been a lot more quality when it comes to this, and I think it's really important to have that equality. So when it comes to your physical health and how is it impacted by your mental health, there has been a lot of correlations made in recent studies about how if someone is mentally ill or mentally um, unhealthy, how that can affect their health outcomes basically. Like their physical body can be affected by what's going on in their brain. So there's often a stigma about mental illness, especially in the healthcare field, and it can create an extravagant barrier between patients and healthcare providers. And I think all of us have seen this at some point, whether it be through clinicals or through our jobs. You know, when you have a psych patient come in, and the first thing you hear your nurse say is, "Oh, it's a psych patient, I don't want it," or "Oh, great, one of these again," or "Oh, they're just here because they're a drug seeker." You know, there's always these stigmas and there's always these assumptions made about these people, unfortunately, because that's just how society has seen them for a very long time. But, you know, the truth is, a lot of them are actually there to get help. And even if they're not, they still deserve 100% of your effort and 100% of the best care that you can provide them. So, this barrier often leads to poor quality physical care for persons with mental illnesses. And if mental health care was promoted by availability through insurance, this stigma may not be as prominent. So, now that it is covered to a certain extent by health insurance, um, we've probably all noticed in recent years that there's been a lot more promotion for mental health. Like, even at the college, they have anxiety workshops to help students that deal with anxiety. And I think that's great as well because, you know, some people that are great with coping with things may think it's silly and a waste of time, but there's people out there that don't have those people to confide in, and it's something that they could really benefit from. So, a study posted in 2018 revealed that cancer patients burdened with depression had increased healthcare use as compared with non depressed cancer patients. So, what this is basically saying is that these cancer patients that were dealing with depression had increased hospital stays that were unrelated to their mental health. Um, The same study showed that annual healthcare costs were lower when mental health visits were utilized, supporting the fact that mental health has a direct impact on physical health. So, these cancer patients, and if any of you have had family members that have gone through chemo, you know that it takes a toll on your body and it can affect your attitude about things. And so, these patients that were depressed, some of them used their resources and they went and got help. And when they did that, they actually had fewer hospital stays related to their physical health as compared to those who decided not to use mental health resources. So that's just an example to show you basically how mental health can have an incredible impact on your physical health. So having insurance to help with mental health visits would not only decrease mental health care costs, but physical health care costs as well. So this is a big thing that people argue. They say, oh, mental health insurance coverage, that's just something that I'm going to have to pay for that's extra, it's not really needed. But in reality, it can help decrease the cost of your physical health care visits as well, because you won't be having as many of them, because your body as a whole is healthy. So financial savings. Common mental disorders such as depression, anxiety, and substance abuse disorders are prevalent in about 11% of the population at any given time. As of 2019, the highest treatment gap for common mental health disorders was 86.3%. Among the various factors thought to have an impact on the treatment gap, affordability of care was identified as one critical factor influencing treatment utilization. So this treatment gap could potentially be decreased if mental health care was made more affordable through insurance. Luckily, insurance has been made more affordable through several acts that have happened over the years, but some people still can't afford it. Especially, you see the prevalence of mental illness increase in people that are below the poverty level or homeless people. So there's some people that still can't afford it. But 11% of the population at any given time is experiencing a common mental disorder, and an 86.3 treatment gap because of money is a really, really big gap. So I believe there's still more that could be done to decrease cost, to get help, because someone shouldn't have to, sell their car to be able to get help with becoming happy again or becoming motivated again. So I believe that something should be done to make it more affordable. So as previously mentioned, a study published in 2018 revealed that cancer patients who used mental health resources had a lower annual healthcare cost as opposed to those who did not. Annual healthcare costs were estimated to be $99,073 for cancer patients who did not have any mental health visits. So that's almost six figures. That is almost $100,000 of mental or not mental health, of healthcare visits. As opposed to the people who did use mental health visits, they had to pay $71,245. And this was for cancer patients receiving a mean of 12 mental health visits annually. So one visit a month could possibly decrease your healthcare cost by $27,828. So, saving cancer patients from further physical, mental, and financial ailments. With that being said, yes, it will cost more money initially, but if people actually use this resource, it could decrease healthcare costs exponentially and overall save everybody money. So then we come to medical compliance. This is something that a lot of mental health patients struggle with, especially when you have those that have more intense illnesses like schizophrenia. They never want to take their medication. One reason is because they think it makes them feel funny, like basically they're not themselves. But another reason is because it's very, very expensive. So psychiatric medications can be very expensive before insurance coverage. Price variation across all pharmacy types for a 30-day supply was the least for haloperidol, which ranged from $20 to $102.99, and the greatest for aripiprazole, which ranged from $29.99 to $1,345. So the highest possible cost was $1,345 a month. So mental health or mental disorders tend to be more prevalent in households with lower income. Hypothetically, if a lower class individual needed aripiprazole for schizophrenia, their monthly bill was, for example, $1,000, it is likely that noncompliance would occur. So if you were somebody who made $10,000 a year and you are still having to pay for, you know, your regular house payment, maybe you have a car payment, you're not going to be able to spend $1,000 every month to take this medication. So insurance could decrease the cost of prescription medications, increasing compliance in taking these medications. So if insurance was able to decrease this cost even by half, a lot more people would be able to buy it every single month, and that would increase their compliance with it, because this barrier is often caused by an issue financially. So this will improve quality of life for the individual, but it will also decrease relapse rates and save mental health facilities a great deal of money. So yes, this will help the patient feel better, but it will also make business owners very happy because they're not having to pile loads and loads of money upon these people that are coming in for mental health visits. So in the end of the day, it will save mental health facilities a lot of money. And fewer relapse. So long-term benefits of that would be incredible as well. So the nurse's responsibility. Overall, mental health insurance could save patients and facilities vast amounts of money. Insurance could also improve the quality of life for those with mental disorders. Both physical and mental health can be improved through medication compliance. Stigmas could be put to rest, and those with mental disorders could seek more help if mental illness was covered as thoroughly as physical illness. So as I said in the beginning, I think it's really great that all this equality is being pushed for mental health. And I think it's great that they don't have any more restrictions on mental health insurance than they do physical health insurance. But it is going to take more than acts and more than laws to get people to recognize that these stigmas are most of the time not accurate. Because a lot of the times, like I said, these people want help, and it's our job as nurses to make them feel welcome and to make them feel like we care. Just as we had somebody come in with a broken arm, we want to help them not hurt. We want to fix that arm and help them heal. We need to look at that the same way as someone that comes in and says that, they've been having an anxiety problem or they've been having a problem with depression. We need to look at that the same exact way. Like, this person is hurting, this person is going through something, and we can help them get through it, and we can help them get better. And who knows, maybe that will help their physical health as well, which is ultimately our job as nurses, to help patients feel better and to help them get their health back, to help them get their health back throughout their whole entire body, whether that's mentally or physically. So as nurses, it is essential to put all personal beliefs aside when caring for those with mental disorders. Keep in mind that these people are not well and they need to be treated. So a lot of the time, as nurses, we have personal beliefs that come in conflict with what we see at our jobs every day. So this is another one of those things, if you're one of those people that think mental health is all like a spoof, you've never had any problems with it, you've never been depressed, you've never had anxiety, you've never just, felt like you were crazy, then it can be a little bit hard to understand that someone else is going through it, because it's really easy to say, oh, get over it, you'll be fine. It's not that simple for everybody. Some people need that extra push. Some people need that accountability from another person, or they need guidance because they don't even know where to begin. And sometimes somebody just needs somebody to talk to about their problems. So it is important for us to use that active listening and be open to communication when they're talking to you, because sometimes they might not even need a consult with a therapist. They might just need to talk to you right there in that ER room. So it's very important to stay open-minded about things and know that just because you're not going through it doesn't mean that everyone else isn't going through it either. So for those who have insurance and those who not, it is the duty of a nurse to research and provide the most affordable options to the patient for the benefit of their health. So we can play a big part in making things more affordable for patients. We can do that research. Sometimes they don't have the resources or the knowledge to do that for themselves. So that's something that we can do, whether they have insurance or not. We can look at alternative medications or different options or different providers that have, less expensive services. We can do things to help them. So overall, I believe that covering mental health insurance or mental health insurance coverage, covering all these visits, could help your physical health, and it could save a lot of money, and it could also increase medication compliance, which at the end of the day is going to help people as individuals, but it's also going to help their physical health as well. So I hope you guys learned something about all this, and I hope that this opened your mind to maybe stigmas that you had. And if you didn't have stigmas, I hope this got you thinking about the importance of mental health and the importance of us supporting it.